Thank you for uh, a nice introduction. So welcome you all. Today is our 11th session. It's about essential emergency and critical care. We'll have, as usual, a case-based discussion. We have invited also panelists from Gondar University Hospital, Dr. Hussein Indris, who is an anesthesiologist and critical care specialist. And without killing time, we'll start with our session. So let's share the screen and let's start.
Is a screenshot, Dr. Ananya. Can you see?
Not yet. Yes, now it's shared. So I'll start by introducing the session, and Dr. Hussein will be continuing through the case. So this case discussion will be based on a case of a 66 years old male who just presented to emergency at a rural setting with complaints of shortness of breath, dyspnea, and diarrhea of 7 days duration. So if Dr. Hussein, if you can pull the slide upward, I can see the objective. Yeah. So this is our today's practice change objectives. So we'll be able to explore acute care, critical care, and intensive care by the end of the session. We'll list the domain across which acute care occurs. We'll be able to recognize the critical care continuum. We'll define essential emergency and critical care. We'll recognize two key domains of essential emergency and critical care. The two domains are identification of critical illness and care of critical illness. We will be able to determine, critical illness using different scoring system and warning sign. And based on this, we are expected to improve care for critically patients through education, training, guidelines, protocol, and use of cognitive aids. And we will be able to identify clinical processes needed for essential emergency and critical care. We'll be recognizing components of hospital readiness, and we'll analyze the gap in institutional resource available for critical care. And afterwards, we'll be implementing this with available resources, and we'll advocate for oxygen and additional essential emergency care resources. So we will see this, in detail, all the objectives in 5 parts. So I think Dr. Hussein, you can continue afterwards with, some epidemiology regarding oxygen requirement as an introduction, and later works with the case updates and of course case discussion. So the floor is yours, Dr. Hussein.
Thank you, Alvin and Dr. Ananya, and thank you everyone who has joined us in this today's session. So as you know, since the COVID pandemic, a lot of countries, including the lower and middle income countries, have suffered a significant shortage in oxygen. And this oxygen, as you know, is a very mandatory life-saving therapy. And unfortunately, fortunately, it was recognized as an essential medication by the World Health Organization recently in 2017. So as the report shows that especially the low and middle income countries need more than 80 million cubic meters of oxygen per day for the management of COVID patients. And the world global level, around 3.9 billion cubic meters of oxygen is said to be needed for COVID management as of November 2021. So from this, you can see how much oxygen is becoming an important part of care, and how oxygen is getting in short. So we need to advocate for the increment in the supply of this oxygen for proper care of critically ill patients.
Yeah, Dr. Hussein, also, our participants also can click on the Learning Resource Center on the map, and they can they can just input, a country, like if they want specific country oxygen need in African countries or Asian countries. So when they go to the Learning Resource Center, they can get that information.
Yes, thank you for that additional point. So having this in mind, you can understand how oxygen is becoming important, how we are being in short of oxygen, and then let's see case. Okay, we have a case here that you are working in a rural district hospital. The nearest hospital with an ICU is 40 miles away. The physician working in the emergency room calls you to come to see a patient that she wants to admit to the hospital. The history of the patient is he is a 66-year-old man with 7 days history of dyspnea, dizziness, and diarrhea. He reports feeling weak, and his dyspnea worse with exertion and better with rest. He receives the Janssen vaccine 4 weeks ago, and upon examination, you get the vital sign as respiratory rate 27, heart rate 97, and BP is 107.59, and the temperature is at 7.5, and just maintain saturation with 95% in on-room air. And he's put 3 liters of per minute oxygen by nasal points, and the saturation becomes 95%. So as we proceed to our discussion, we will see how what acute care and critical care as well as intensive care mean, how they are related and how they different. And we will see the domains in which acute care can be delivered, and we will recognize the continuum of critical care in critically ill patients. So to proceed, here is a question. What does acute care mean? What does acute care mean? So there are different definitions of acute care, but as you can see, acute care mainly it emphasizes on the importance of time, or the importance of urgency in management to improve the patient's outcome. So the WHO has given a definition, as you can see. It is acute care is services responsive to life-threatening emergencies or acute exacerbations of chronic illnesses, and main routine health problems that require prompt action, as well as its effectiveness largely depends on time-sensitive and frequently rapid intervention, and the care delivery platforms used to treat sudden, often unexpected, urgent, or emergent episodes of injury and illness that can lead to death or disability unless we establish our rapid intervention. And importantly, from all these definitions, you can see that there is prompt action, the need to time-sensitive and rapid intervention, and different words that shows the importance of time. So most most definitions emphasize on the time pressure. Okay, so always think of time whenever you think of acute care. So this is a question for you. So where does acute care occur? You have 30 seconds. Everyone is encouraged to write your answers on the chat box. Please involve. Okay. So for 30 seconds, where are possible places or domains that acute care can be delivered using? Okay, very good. Matsala says, yeah, Amara, emergency ICU, neonatal ICU, wards, excellent, emergency unit. Yes, very good. Thank you for your participation. So there are different places, okay, in which we can apply this acute care. So these are the domains mainly involved. So we have a trauma care and acute care surgery, whereby patients may come with trauma, or they may have acute surgical conditions that may need prompt intervention for their a good prognosis. Emergency care, of course, a lot of patients who need immediate attention, like myocardial infarction, stroke, and so on, may present to you. So acute care should be established there. There are also urgent care centers and short-term stabilization areas, and also importantly, that pre-hospital care also needs acute care centers, like also critical care. Of course, as you know, it is a place where different critically ill patients are admitted, and acute care as well as intensive care therapies are implemented. So always think of these areas where acute care is important. So the term acute care actually encompasses the range of clinical healthcare functions, okay, or healthcare services, which include emergency medicine, trauma care, pre-hospital emergency care, acute care surgery, critical care, urgent care, and short-term inpatient stabilization areas are the domains where acute care is important. So for further discussion, you can tap the link here and you can see the details in each unit. So we have seen that acute care means where the healthcare intervention is time sensitive. So what does critical care mean then? How do you define critical care? And where does this critical care occur? How does it differ from that of intensive care? Anyone, you can write on the chat box as usual. We have 30 seconds only. What does critical care mean? Where does it occur and how does it differ from intensive care? Let's proceed for the sake of time. So critical care, you can see from your screen that critical illness should be seen as just one part of the patient's disease trajectory, and how the patient's managed before and after ICU admission has an important role to play in optimizing patients, starting from the hospital care, how the patient is cared in the emergency department, and how the patient is transferred to the ICU, as well as how this important critical care interventions are provided in the ICU, as well as how the patient are followed after ICU discharge for further rehabilitation, will affect the patient's outcome significantly. So we need to be able to identify critical illness early before it reaches a stage where it's life-threatening. And it requires a combination of improved and more frequent or continuous monitoring of at-risk patients, and also enhancing the workforce by training when the patient is deteriorating, and also developing a system to communicate with appropriate person, as a means by calling for help, or how we need to respond for a call. So a continuum of this critical care is very important, okay, to improve the patient's outcome. This continuum of critical care extends beyond the ICU care. That should take into account, like after ICU discharge, we need to have their physical, psychological consequences of their critical illness should be sought overall to improve the patient's outcomes. So here we have the, can you see this continuum of critical care diagram? Anyone? That's visible, right?
Yes, visible. Good.
Yeah. So what this diagram depicts is that in the older paradigm, the boxes where there was a space or a gap between each boxes, as you can see. But in the newer paradigm, they each have an intersection, and it shows how the preceding, the collaboration of each unit is okay. The EMS and the emergency room should have, important communication, and the patient's intervention should not be a gap between each continuum of the care. It's to show that how our collaboration, how our communication and timely, effective care improves our patient outcome. So always think of this interrelation between different units. So after having seen this, what acute care and what critical care is, and as you see, ICU, or to add on ICU means it's a place where further intensive care, including continuous monitoring, like invasive monitors and intensive organ support, will be provided. So having seen this concepts, let's update our case. You have seen the previous patient, and additional patient history is added here. The patient has no previous medical history, and he states otherwise healthy, and he's even football. He regularly plays football, and so no previous surgical problem, and he is non-smoker, has no medication or allergies, and also no systemic symptoms can be identified from the patient. And on the CT scan with contrast, you see a bilateral interstitial pneumonitis that's consistent with SARS-CoV-2, and no pulmonary embolism. So embolism is seen. So your plan is you and the emergency department physician decide the patient to be admitted to the hospital ward with oxygen therapy, and antibiotics started for possible community-acquired pneumonia, and dexamethasone was also started for COVID infection, and further tests and workups are on process. So the question is what's like the problem in this patient? That means to identify is the patient critical patient or not, to identify how the patient is managed, which of the following are considered critical patient care. You can see the choices from 1 to 5. So you can answer your questions on the chat box. Which of the following are considered critical patient care? 1, early recognition, assessment, and decision making for deteriorating patients, rapid and timely intervention, identification of clinical warning signs, and providing expert assistance whenever needed. The 5, all of the above are considered. Choose one of them, which you think are considered as critical patient care. Okay. They'll say 5 all, Adisu all, yes. Yeah, so thank you for your participation. Then, the exact definition or to consider what critical patient care is may differ due to different reasons. So one is, critical illness cannot be diagnosed, okay, with a point in time or with a single test. So it needs, a lot of multiple investigations and so on. And also, even though critical illness occurs in ICU or outside ICU, usually, the data is collected from ICU that limits our definition of critical illness. And due to these reasons, it may be different, but overall, all these mentioned issues are included under the critical patient care. It encompasses early recognition, assessment, decision making, and rapid and timely intervention whenever needed, and also having warning signs that can aid us in identifying patients who are at risk of deterioration and providing or seeking expert assistance whenever needed. All are included in the critical patient care continuum. So from the above case, we need to discuss to get the following objectives. You can see we will define what essential, emergency, and critical care mean, and what are the domains of this essential and emergency critical care, which includes identification of critical illness and giving care for such critically ill patients. And also you will be able to determine what things aid in identifying critical illness, and also finally you will improve your care for your critically ill patients in your setup. So you have a leading question here. So
yeah, Dr. Hussein. Yeah, Dr. Hussein, maybe before proceeding to this question, we know almost we finished the first part of our session. It's about acute care, critical care, and intensive care. So we want to make sure that if our participants understand, the difference and similarity between these three: acute care, critical care, and intensive care. So if they have any question, I just wanted to give them a chance.
Thank you, Dr. Ananya, for your,
yeah, it's going to be an input for the next session. They have to understand, yeah. So participants, do you have any question, or is everything clear regarding acute care, critical care, and intensive care?
Any questions? So, so far we have discussed what acute care means, where are the domains that acute care can be applied. We said it starts from the pre-hospital care, into the emergency, into the critical care, and also it may extend to post-ICU discharge. And we say also what critical care means to improve the patient's overall outcome.
Yeah, I think there is one question. Among these care, which one comes first? Is a question from, yeah.
Okay. So, Dr. Ananya will add after me. So, there is no time sequence for each case, but the condition matters. That means acute care, as we said, it mainly emphasizes on the time pressure or the timeliness of our intervention, while that of critical care implies how our intervention will improve the patient's outcome, like how the patient's illness is severe enough that will result in days or poor outcome unless the required intervention is given. So both can be applied at the same time or at the same place as well. So there is no time, there is no temporal difference between the care.
Yeah, maybe the other way of understanding this should be, when we say acute care, it may involve everything in one. The most important part of the definition of acute care is timeliness of care. So there are conditions which requires, timely care, timely intervention, so that you can save patient life. It could be acute surgical condition, it could be emergency medicine, it could be, a need for inpatient stabilization for a patient. So when we say critical care, then the issue is about, if you are not intervening a patient immediately, it can progress to life-threatening condition. So critical care can start at the point where you see your patients. And acute care also can start, at the pre-hospital settings. So it's not like you start with acute care and critical care and intensive care. Of course, intensive care is something you are going to provide in the ICU, as the name implies, intensive care, and it needs, intensive monitoring and management. But, critical care is a continuum process. It may start where you encounter the patient, pre-hospital, hospital, then at different departments. But acute care is a general term given for those conditions who needs timely management. So it's not something, a continuum of process between acute, critical, and intensive care, but they mean something by themselves. So it should be understood in that way, not in a sequence of events. But definitely intensive care is something you'd find in the ICU, critical care is throughout, the process, and acute care implies to acute clinical conditions. And when you give care to acute clinical condition, we call it acute care. Is that clear maybe for Dale? Yeah, I think probably maybe clear. Yeah. Thank you, Dr. Hussein. It's a good elaboration.
Don't think of like sequential interventions.
No.
That of different considerations. Different considerations. Okay, so we'll proceed to the next discussion with the objective of defining what essential emergency and critical care mean, its domains, and also using warning signs and scoring systems to identify critical illness, and also ways to improve care for our critically ill patients. We have a question here. True false question. Critical care and emergency care require expensive technologies and high-skilled healthcare providers. We have 30 seconds to answer this, true or false. Do you think that critical care and emergency care require expensive technologies and highly skilled healthcare providers? False. Participating. Thank you. False, Daniel. Hi, false. Very good. Thank you. Okay. Thank you. Andre Jonathan. Okay, thank you everyone for your participation in answering this question. So there might be now a misconception that critical care and emergency care need expensive technologies, luxury technologies, and highly skilled healthcare professionals among different healthcare professionals. But the reality is, very different in that critical care and emergency care can be, delivered with available resources that's found in every healthcare setup. The matter is how we approach or how we organize our care system in being able to identify critically ill patients and how we are responding for such needs. We don't need to have expensive technologies and highly skilled individual. Every health professional needs to have the skill to identify patients who are critically ill or who are at risk of deterioration by using simple clinical methods like having vital sign monitoring, frequent vital sign monitoring, which includes respiratory rates, heart rate, blood pressure monitoring, temperature, their saturation, their mentation, and so on, following just those conditions by clinical method will help us identify this patient. So we don't need to have an extensive technology. But for further care in intensive care unit, we might need to upgrade our technologies and further instruments may be needed. But for this care, we don't need to have extensive. So what is an essential? This essential emergency and critical care mean? So essential and essential emergency critical care is defined, as care that all critically ill patients should receive in all hospitals in the world. Okay, then as a name plus, it is essential. So this should be available for all patients in all parts of the world in all hospitals. So, and this is a concept that has a place in the universal health coverage. It is low cost. Okay, it doesn't need any complicated or expensive equipment, and also it's appropriate for all patients or all countries in all settings in the world. Okay, it's intended for all patients respective of their age, including neonatal patients, children, mothers, and all patients respective of their diagnosis, the specialty, or even location. So it's recognized under the universal health coverage component, and it's defined as it's a set of actions and treatments plus a system-wide requirements for their provision. It has its own sets of actions and treatments, as well as it has also its systems to develop in a given hospital. Okay, So it has mainly two domains, as you can see from your screen. Two domains, that's identification. We said identification of critically ill patients and caring for those critically ill patients is what it constitutes the essential emergency critical care service. And also we need also a hospital readiness in terms of its infrastructure, its structures, its human resources that are important, and also in terms of human resources as well to provide effectively these services. So we will see each component is needed for identification and needed for care of a patient in terms of the structure, in terms of the human resource, in terms of the supplies, further in our further discussion. So we have a case, okay, before we go to the discussion, we have a case, okay, updates of our previous case. Then you previously you have decided to send the patient to ward, so you have sent the patient to the ward, and despite putting on 3 liters of oxygen, the 2 hours after you admit the patient, the saturation drops to 86%. Okay. So what is the problem in this patient? Do you think that the patient is critically ill, or do we need to provide emergency critical care for this patient, and what is the reason behind? So if you answer this question, so that means you are able to identify patients who are in critically ill condition. What is the condition or the clinical problem that you think this patient is a critically ill patient? Your participation is very welcomed. Hope you understand the question, right? The question is that our patient, after admission to the hospital, we put him on the 3 liters of oxygen, but despite that, his saturation drops to 86%. So do you think is this patient critically ill or not? If you say so, why do you say? That's the question. So the first question is this patient critically ill patient? Okay, so let's proceed to the answer. So, of course, this patient is critically ill due to the fact that the patient's saturation is deteriorating despite your yes, some of you has answered actually. So since the saturation is dropping, so we consider the patient as having a critically ill condition due to his saturation. So what are the criteria that we can use to say this patient is critically ill? These are, we can see the respiratory rate, the pulse rate, the blood pressure, either are they dropping or not. We can see the mental status of our patient. Is that confusing, lethargic, comatose? How is the patient doing? And also any concern from the health professionals or from that of the caregivers also can prompt us to consider this patient as to initiate our evaluation for possible critical illness program. So who is responsible for identifying these problems then? The patient is admitted to the ward. Who do you think is responsible to identify? So yeah, basically everyone in the health system, including the physician, the ward nurses, are responsible to identify, the critically ill conditions in a patient. And what's needed to identify the problem is just frequent monitoring, taking clinical vital signs with available resources which are cost-effective, like you may have, a non-invasive blood pressure monitor. You may have, counter the breathing, the respiratory rate. You might count the pulse rate, and if available, you might check just the saturation by using the pulse oximetry. So, what should happen next then? You decided this is the patient. You identify the patient as having critical ill condition. So, what we should be then next to this patient. So we need to do what? We need to escalate our oxygen care from intranasal into either into the form of face mask oxygen, or if needed, intubation and mechanical ventilation may be considered as appropriate. So this is what identifying a critically ill patient looks like. So we have treated our patient. Now after identifying the patient, then the nurse calls you. You arrive, the patient is alert but appears to be working harder to breathe, and he's unable to speak sentences properly, okay, at a time. So vital signs, as you can see, respiratory rate 27, temperature is the same, heart rate is 93, BP is 112 by 79, saturation is 86, okay? So after identifying these patients, we need to have a system. We need to develop a system to identify deteriorating patients so that we can identify them early to initiate appropriate care. These systems are called the rapid response teams. Okay, these are the rapid response teams are designed to intervene during critical incidents, like in the ward, in the emergency department, whenever necessary. As here, I want to differentiate this rapid response team from that of the code blue teams. In different hospitals, there are code blue teams which are called upon a cardiac arrest patient to give ACLS in the hospital. But these rapid response teams are not like that. These are, ward individuals, okay, that are near to the patient at a time, so they are required to immediately or emergently respond for a critically ill patient, or they are required to early identify a patient who is deteriorating early, unlike that of the code patient. So to aid this, to facilitate early recognition of patients, there are different equipment, techniques or strategies that are employed in different hospital setups. Among them, there are warning signs, different warning signs, and different scoring system to enable the health professionals easily identify patients. So what are the warning signs that you employ? Actually, you have discussed this issue. So at least mention at least 3 warning signs that patients may exhibit prior to deterioration.
Dr. Hussein, like while they're listing out some of the warning signs, can we say a bit about rapid response team? So this is not common in our setup, and what will be different health professionals will be in a rapid response team. So as you know, usually it may be difficult in settings, especially away from tertiary centers, to have this rapid response team. So the usual trend is a nurse will be staying by the patient side, and whenever she noticed, or he or she noticed, a change in vital signs or other parameters ordered, they tend to call, a physician on duty. So the physician just arrives as a rapid response team. It's just the difference is just a single man alone and evaluate the patient and decide for next of care. But the idea of rapid response team is having a group of people will be called whenever there is a problem, right? So what kind of health professionals can be part of rapid response team? It's good if we see, uh, from case needs, they have these lists, right? So you can show them also for participants.
Thank you, Dr. Ananya. Okay, my network is trying to display it. So a bit the network is delaying. So yeah, as Dr. Ananya said, there are different health professionals, okay, who can be included in the rapid response teams in hospital. It may differ from one hospital to the hospital. Okay. So meanwhile, the network is searching. You can list at least 3 warning signs that patients may exhibit prior to deterioration. What are the signs that may show that the patient is going to deteriorate soon? Okay, what's cough breathing, vital sign arrangement, and nature of primary disease. Okay. Okay, this saturation. Yeah, so actually we have mentioned some of them. One thing I want to emphasize is that in most cases, or almost all, patients exhibit a certain sign before they deteriorate. Usually, they are preceded by a certain signs that hours prior to deterioration. These signs are easy to identify. They require extensive equipment, which includes the respiratory rate, the pulse rate, the blood pressure derangement, the saturation, the mentation, because these all are what we mentioned previously. So these are the warning signs that we can see in a patient before deterioration. So, there are different models, okay, in the previous health professionals that can be included in the rapid response teams, includes physicians who are like a critical care specialists, the emergency specialists, or nurses, okay, who are specifically trained for emergency critical care cases. The respiratory therapists also can be included in the team. So in your hospital, you have a physician, you have a nurse, so you can at least establish these rapid response teams in your hospital. So yes, we have said the warning signs ahead of that. So having this in mind, there is a new score which is developed by the National Health System in the UK, and we can see the score. Okay, the score, this new score is developed and designed to enable the health professionals easily identify patients, and it has different components with specific scores, as you can see on the screen. It has respiratory rate, breaths per minute, the presence or absence of hypercapnic respiratory failure, the presence or the need of supplemental oxygen or not, the temperature, the blood pressure, the pulse, and the consciousness or the mental status, with each having different scoring system. And adding this, we will get a certain score. So based on that score, we will decide our patient's category. So based on this score, what is the new score of our patient? Remember, our patient is, the vital signs are given here. The respiratory is 27, temperature 37, the heart rate 93, and BP, as you can see, saturation 86. So let's see on this scoring system. So the patient respiratory is +2, okay? I mean +3. He has no hypercapnic respiratory failure, and he needs supplemental oxygen, then +5. The temperature is between this 0, systolic blood pressure between this and 0. The pulse rate is 93, so we have +1 here. So the patient is alert. So the patient, we have a score of 6 based on this new score. So we can employ this scoring system so that we can easily identify our patients. So you decided to increase the patient's oxygen because the patient's saturation is still 86 despite your oxygen therapy. So you decided to increase the oxygen to 50 liters per minute. This is, an example of a care of critical illness. You identify the problem, then immediately you identify this critical illness. So you need to intervene timely to improve the patient's outcome. So the question is, how can you know that, or what? How can you know that what treatment is or what further care is required for the patient? So the issue of education and training comes here. So after identifying the patient, how to proceed to the patient's care needs ongoing and continuous updates in terms of knowledge, in terms of skills, and if there are any updates and guidelines developed. So you are, as a health professional, you are encouraged, or you are highly required to update your knowledge through education, through training, and through reading different guidelines and protocols that are developed in different parts of the world. And it's highly advised that you have your own protocol developed for your setup, because directly applying all the guidelines and all the protocols that are prepared by different setup might not suit your setup. So making or adopting such guidelines and protocols to your setup is advised. So for further reading materials, you have different protocols and guideline links. Okay, you can see in your daily practice as you want. So, and even a trained individual, okay, even a trained individual, those who take training, those who are reading different protocols and different guidelines, sometimes might not able to routinely apply their knowledge, especially in the time of stress during a critical event. Okay, so the use of cognitive aids is a solution for such problems. During the stress of a critical event, the majority of clinicians do not implement all known-based practices optimally. So to avoid this, you can prepare your cognitive aids like in a short form. This is an example of the emergency manual, okay? So you can prepare it in a short form and put it in your working place, either on the board or on the tables, okay? So that you can, it can aid to remember you in times of stresses due to unexpected critical events. Okay, so this is the examples of cognitive aids. Okay? Cognitive aids are something that will help you remember, okay, what to do in times of critical incident. Okay?
So, Dr. Hussein, how is your experience with cognitive aids? Have you used them in emergency situations? How useful were they in your experience?
Yeah, for example, like in our experience during operation, different incidents might happen, including difficult airway, okay, during intubation, so on. So we will have our cognitive aids that will show how to proceed with difficult airway. So we can print it out and put it on the operation theater table, so that whenever we need, like airway algorithms and cardiac arrest algorithm as well. Also, we have that cognitive aids. You can use such aids.
Yeah, I remember using a cognitive aid for hypoxemia, intraoperative hypoxemia. So suddenly the patient became hypoxic and were in a rush. So it's a lot of anxiety. So we wouldn't actually remember the steps how to go with. So while intervening on the patient, an assistant will assign someone to go through the algorithm of hypoxia, and he was almost dictating, do this first, and do this, and do this. And in that way, almost we provided optimal care, diagnosed the problem, and we successfully managed hypoxia. So it really helped us in order to manage, the condition optimally than just go haphazardly. So it's always good to have this cognitive aid at your area of working, at emergency department, ICU, operating table, or any place where you do acute care services. So these are really important. It really change our management and the patient outcome. Yeah, thank you, Dr.
Thank you, Dr. Anya. Yeah, cognitive aids are an important instrument. Even an experienced individual might not, might miss a lot of important steps in times of stress. So having this aids is highly encouraged in your daily practice. So, so far also we have seen how we can identify a patient who is at risk of deteriorating by using different warning signs and different scoring systems, and also the use of this cognitive aids to ease our work. So the next session, okay, in the next session, how we actually implement our emergency and essential emergency critical care in our setup. How can we put into practice actually? So in this session, the next discussion, you will need to list the clinical processes needed to identify and care for critical illness, and also you'll recognize components of hospital readiness. What are the hospital requirements for fully implement this essential emergency critical care. So to make clear how this essential emergency critical care works in practice, you can see this diagram. We have we said it has two domains, that's the identification of critically ill patients and providing essential care for the critically ill patient. This each requires the presence of clinical process as well as hospital readiness in terms of infrastructure, in terms of system, in terms of human resource. So the overall integration will result in effective implementation and coverage of the essential emergency care of the patients, which results in good outcome in the critical ill patient with good survival. So what we see is what are the clinical practices and hospital readiness that are required to identify critical ill patient, and at the same time, what are the clinical processes and the hospital readiness to effectively deliver our essential care for the critical ill patient is the next discussion. Okay, so you have a table here, okay, which has many components, which we don't have to mention all of them, but in short, Farmer is the founder of the patrons in the health, okay, coined the expression of staff, space, and system. So the effective implementation of this essential emergency care requires appropriate human resource in terms of training, skills, and also it needs staff's different equipment, even though they are not high expensive and complex. We need at least basic instruments and equipment, and also space, appropriately allocated space that's designed for caring such patients, which might include the triage place, the emergency department, and critical care setup might be important, as well as the system, how we can communicate between the health professionals, between the patient and the healthcare professionals. Such things need to be properly set up for effective implementation of this care. So specific contents of this specific contents of the essential emergency critical care are listed here, as you can see. Okay, one is the processes. Okay, what are the clinical processes for effective implementation of essential emergency critical care? For identification, you need to have what? You need to have a vital sign based triage system to identify critical illness. Okay, so in triage, you can use the different vital signs, which includes pulse, blood pressure, respiratory rate, saturation, temperature, okay, and different other clinical conditions that can easily be identified. Okay, the other one is the time. Okay, where should we do? So whenever the patient arrives to the hospital, okay, you need to triage the patient by identifying this high risk or this warning signs. Does the patient have these signs or not? So that timely and optimal care will be delivered for the patients. And also patients at least every 24 hours who are in the hospital or in the general ward, at least they need to be evaluated every 24 hours, and you might increase this frequency depending on the patient's clinical condition. For example, in ICU, you might need to monitor frequently, even within every 30 minutes, every 1 hour, depending on the patient's condition. So it's to remind you that you need to have a certain protocol, which vital signs or which things, which clinical conditions to monitor, as well as how frequent the patient should be monitored. And also during surgery or during anesthesia, and even after that in the PACU, and after also discharge from the ICU, okay? And the reevaluation after the patient is discharged from hospitals or from the ICU, they need to be reevaluated with the appropriate time, frequency, and the appropriate vital sign mentioned in this table. Okay, and the second component is the care. Okay, so once you identify the problem in this patient, you need to be able to deliver appropriate care. So how can we how can we give care? So this depends on the system. Okay, the system which the patient has a problem, as you can see, either in the airway problem, the breathing problem, the circulation problem. Okay, so we will not discuss each point here, but what's important to take here is that essential care of critical illness is initiated, okay, as soon as you identify the problem in each system with appropriate identification system, so that you will initiate appropriate treatment. For example, if you see the patient is not breathing properly, then you need to open the patient's airway with the use of different airway instruments. If there are any secretions, you need to suck. If there are foreign body, you need to remove it. And also, if the patient is not breathing well and saturation is dropping, then you need to start him on oxygen supplement by using face mask or by initiating mechanical ventilation whenever needed. Okay, and also in terms of circulation, okay, you might need to optimize the patient position. You might make flat position. You may compress, the lower extremities. Okay, I mean the bleeding in the lower extremities or any place to stop the bleeding. You might give fluid, okay, or you might start vasopressor as needed. So having these instruments set in your setup will help you easily respond for the patient's response. Okay? These are the clinical care processes required for identification and care of the patient. Then what's the hospital readiness then? What should the hospital look like, okay, to be able to give care for such patients? So there is a question, okay, list the elements of hospital readiness needed for identification of critical illness. There are categories, okay, there are categories: equipments, consumables, drugs, human resources, okay, and infrastructure as well as. From the equipment, at least you need to have what? A clock. We said acute care and critical care are time sensitive, so you need to monitor your time. Also, pulse oximeter with functioning probe is mandatory. Blood pressure monitoring equipment, thermometer are important equipment. As you can see, these are not that much expensive and that much complex. So we can initiate or we can implement this essential care in every city. Every hospital can have these equipment. And the consumables, you need to have different infection prevention consumables like disinfectants and gloves. Drug to provide essential emergency critical care. You don't need to have expensive drugs. Okay, just you might need only adrenaline or atropine in some cases. Otherwise, even without any drug, you can provide appropriate care for the patient. Human resource, okay, health workers. What you need is available 24 per day available health professionals, either physicians, ward nurses, and other allied health professionals are important sources for the care. And these human resources should be supported by what? Training, education, and developing guidelines and protocols in the hospitals is important for the timely intervention for this patient. Other is the infrastructure. Okay, you need to have a designed triage area. We talked previously. You need to have, the emergency unit. Okay, you need to have the designed area for triage, for pediatrics or adult, and also what you need is the running water. So with you can see how simple the requirement is in terms of the equipment is to establish critical care in hospital. And to care for such patients, what you need is also in the same category as equipment. You need to have a suction machine. It could be manual or electrical. You need an oxygen supply, of course, definitely. Bag valve mask, or the ambu bag, what you call, okay? Heat sources to manage the patient temperature, those who are hypothermic. Other consumables is, you can see a lot of mentioned consumables here, okay? But as you can see, most of them are not that much expensive and complex, okay? So gauze, IV cannulas, lines, fluid, NG tube, face mask, okay, charts, and so on. These are simple, easy instruments, but their benefit is very important. Okay? They give an important benefit for a patient. From the drugs, okay, we said you may need glucose, okay, adrenaline, magnesium sulfate, okay, local anesthetics. Some of common drugs that are available in every hospital are sufficient to provide appropriate care. Human resource, we talked about that. Okay. Probably additional senior individuals who are trained specifically for critical care might be needed. Okay. So yes, there are different guidelines developed in different setups. So you need to adopt those guidelines and protocols in your setup. Okay. So what are the processes then? What should be a process in a hospital to provide this emergency critical care in a hospital? What is the general process? You can read, okay? There are about 10. You need to have additional staffs, additional senior staff that you can consult whenever needed. Essential emergency should be respectful, okay? And it should be patient-centered, okay? And also they should be available for all patients, irrespective of their paying ability, okay? They should be provided without any financial hardship. And also they need to be provided in a place where continuous observation, okay, are available. Infection prevention should be applied in those areas, and there should be a clear way of communication between each health professional and also between the patient and the health professionals as well. Okay. Yeah, and this after all, this essential emergency critical care should be integrated with other cares, okay, for proper implementation. And another is that the COVID-19. As you know, COVID-19 has emerged as a new challenge for our setup. So there are other additional clinical processes and hospital readiness requirements that are specifically required for COVID-19. So you will read in your home time, okay? Since it's available in your, it will be sent to you through email. Okay? You will read such components. So far we have seen how we can identify critical ill patients and how we can care for critical ill patients, and what are the clinical processes, okay, or the clinical practices that are needed to implement, to implement identification of critically ill patients and to care for critical ill patients, as well as we identified the hospital readiness that are needed for the proper identification of these critically ill patients and to give appropriate care for those patients. So the next step will be you will be required to analyze your setup. Okay, to analyze your setup. What are the gaps? What are the gaps of your setup in terms of human resource, in terms of clinical process, or in terms of equipment availability in your setup, so that you will develop a system to improve in order to improve the gaps that you identified. Okay, so what I want you to write down, okay, some of the gaps that you identified in your setup to apply or to implement this essential emergency critical care. You have around 1 minute, so please forward your ideas. What gaps do you think your institution have to effectively implement this essential emergency care? That means what equipment are you in lack? What human resource are you in lack? What processes are you in lack? Or what setups, what systems, or what hospital systems are lacking in your institution to implement what we have discussed so far? Okay, thank you. It says poor hospital readiness, especially for those emergency drugs. Okay, yes, we said that at least we need what? For identification of critically ill patients, we don't need any drug, right? But for caring, we need like adrenaline, diazepam, magnesium, glucose, and so on. We said, right? So you might identify this gaps in the hospital. Okay, and Daniel says in our hospital, VLH, not well organized ED team, and there are no infrastructure. Okay, it would have been nice if you have mentioned specific infrastructure that you are lacking. Okay. Others, equipment, monitoring, Mara Gabriel. You know what I mentioned is at least we need to have what? Equipment, at least the pressure monitoring, pulse oximeter monitoring, okay? Glucometer, you might use the equipment. Otherwise, you can count the pulse, you can count the respiratory rate, you can easily see the mentation. So still you don't need to do the expensive materials. And also you don't need to have fancy monitoring equipments, okay? Okay, others?
Yeah, as Dr. Hussein, you are seeing, most of the time it's not about, equipment infrastructure or, supplies. For essential emergency and critical care, what it seems to be severely lacking is the system and also, the education, training, and having the guideline and having cognitive aids and organizing all this into effect is what I see a problem in many of our institutions in the periphery or the center. Otherwise, as you are trying to say, essential emergency and critical care may not be as expensive as we thought. It really needs human power and some basic life-saving equipments and drugs and monitoring tools. And most by far are available in most institutions, but the way to use them into system in an organized way and education of our health professional is something I feel is lacking. So I think you agree with me, Dr. Hussein.
Thank you, Dr. Ananya, and those who involved. So, as a guide to analyze the gap in your setup and to improve this gap, what you need is, you can set what is your goals, okay? And then you can see what are the actual realities in your setup, okay? And after you identify your gaps, you will set a certain goal and you will do towards that goal. But as Dr. Ananya says, we don't think that this essential emergency critical care service doesn't need, expensive materials or sophisticated materials and equipment. Just what we need is, creating the need. The first thing is the need, okay, the importance, okay, establishing the system, okay, to communicate and to monitor patients, to identify patients, and then developing a system of providing this simple but important care for critically ill patients. Okay, so as a guide, you have a table, okay, an example guide. So you will have a problem list here, okay, in this row, and you will have what is your current practice, and then what is the best practice, what are the protocols, what are the guidelines say or recommend. So you can put it here, and what are the gaps, what's the difference between the best practice and the current practice, and then what actions can be taken to improve our current practice towards the best practice, and then what are how can we monitor our process. So by developing this type of action plans, you can devise a way to improve a setup in your institutions to establish an effective essential emergency critical care is the message. Okay? So to identify the gaps, you can use the SPAR or the SWOT analysis technique. Okay, what is the situation, what is the background, the assessment, and what recommendations can you say, or you can use the SWOT analysis. Okay, strengths, weaknesses, opportunities, and threats in your institution to establish this system, and then finally and hopefully you will establish an effective essential emergency critical care system in your setup with available resources in your place. That's the message.
Thank you, Dr. Hussein. It was a quite interesting session today. This was about essential emergency and critical care, and this was our practice change objectives. So I hope from the session we all got all this information regarding, defining acute care, critical care, intensive care, and also essential emergency and critical care is well elaborated. And the best thing to do now is to go through lecture material and design the system in our setup in order to make our emergency and critical care service more efficient. Or in some setups where we don't have such a system, we need to devise such system. And this teaching material really makes things easier, as there is a list of requirements or a list of things we have to collect in order to set up essential emergency and critical care. So I think we'll close our session maybe by giving you some 30 minutes, 30 seconds for you to raise any questions that's not clear for you, or anything you want to suggest, or anything to complement on the topic. So let me give 30 seconds. So I'll be expecting it on the chat box. Any question, comments? Yeah, so can you share us a link to critical care guide? Thank you. So yeah, this is going to be shared through Telegram and also through email, and you can have an access to the Learning Resource Center and all the guidelines which Dr. Hussein was showing. So a lot of guidelines are here regarding critical care, emergency care, acute care. So, okay, very good comments. So we'll wind up our session. I would like to thank our today's panelist, Dr. Hussein, for his time and for his nice presentation. Dr. Hussein, if you have something to say or a final word, you can say something.
Yeah, thank you everybody for joining us. And the final saying is, do what you can, where you can, with what you have, is my last message. The word of Taylor Roosevelt. Okay.
Yeah, thank you very much. So according to your resources, you can do whatever. If you strive hard, then it's not going to be difficult to deliver essential emergency and critical care services. So that's a message. Thank you, Dr. Hussein. So would there be, Kevin, are you around to give a closing remark, housekeeping?
Yeah, Doctor, I'm there. So this. So thank you everyone for joining, and having the next session on April 26th. That will be also. Thank you everyone for joining. This is our Telegram community. You can just type them to join the link. So, thank you.
Thank